So we early on decided, because we're health educators and the whole world was upside down, that in education, some of our job is just to listen and to hear people's stories. And we thought, what would happen if we decided to create a video archive of healthcare providers, rural providers, primarily from Northeast Colorado, who would just share their COVID stories. And we started March, and we now have 75 plus of these amazing videos, and they're heart-wrenching. They're stories of resiliency and perseverance, and really the stories about the rural community, that the can-do attitude. And so our primary goal with those is to archive them and save them for the future. That's what we wanted. That was our initial plan. But what we're finding is that there's a lot of trends about COVID loneliness and isolation. And it really made us start thinking about, what are the long-term impacts of COVID? And how are people been managing now for 6 months? So that's the second part. Today I'm doing a follow-up with Kindra to say, how are you doing? What did you learn? How are you doing, Kindra?
Oh, Monica. Yeah, I'm, what's gotten harder for me is how it's impacted my colleagues and how it's impacted the normal work. The normal work has just been put on the back burner almost. And we've had our priorities. We thought we were just going to reset our priorities for a few weeks. And now that it appears that it's going to be a long haul reset of priorities, and we're likely to put influenza on top of COVID, it's a bit more daunting. And figuring out how we engage leadership in those discussions has also become, it used to be we just give a report to the CEO and or to the board, and then in a week or two or a month or two, we could tell them, well, we weathered that period of time and now we're back to normal. And we can't do that now. And so we're frustrated. And we have board members, speaking of which, they're kind of weary of some of this. In our community, we continue to have our board recertify the state of emergency every month. And we're kind of lucky in that respect. That brings us opportunity to discuss with our board a little bit. It also, I think, clarifies that we remain in a state of flux. I'm not sure that the state of emergency is, that's the only option there is for declaration. Because it feels almost like we need to declare an ongoing epidemic. It's still ongoing, but somehow or another, the emergent part of it has changed to an ongoing.
So how has that affected the morale by always being kind of at the ready, but not in crisis?
Yeah, tired. People are getting tired, and when people are tired, then it becomes personality over principle, and the fussing that's going on, it has more to do with being tired than policy. Just exhaustion. And I don't know if it's physical exhaustion, just that mental exhaustion of what's today, and we're constantly changing a plan, or we're getting new legislation or new advice. And do we look at CDC? Do we look at CMS? Do we look at Colorado? What's locally? Who's the boss here, and who really do we need to, what do we need to follow? Which makes people weary.
So what steps are you taking? You've identified this huge problem, do you even have the personal fortitude and strength to address that?
I think I'm in the interim. And so, nobody raises their hand interimly during a pandemic, but a few of us that are wisely crazy. But, I think it comes back to just fresh eyes. In the comments, nobody's done anything wrong. We're just have some fresh eyes. Let's just reassess. Kindra's pushing the leadership. Let's bring in something fun and let's just stabilize here. And, people have new roles and responsibilities, but with a tone of, we can't make a mistake as long as we're communicating and working, and moving forward. With that being said, that sounds a lot more diplomatic than maybe some of the, the situations that we have, but I think it's just, I'm fresh. I come in the middle of COVID. And so it's easier for me to keep my patience and be very objective. And I think people like that because I have no history with anyone here. And so, I can say, that's okay. Let's work through it, talk through it. And as long as the leader doesn't get mad and throw a fit, I think that helps to stabilize, even though maybe people below me may be banging heads a little bit. The whole key to me is just stable, slow and steady wins the race.
So Darcy, were you from the community or?
I live in Kansas. I live east of here about an hour and 15 minutes at Oakley, Kansas.
In Oakley,
and
okay.
So I've worked in the for the last 20 years, I've been in the Oakley Critical Access Hospital and then Colby's.
Okay.
Predominantly, probably more in the role of CFO. I was the CEO at Oakley for 7 or 8 years. But my background's finance, and so I slipped back into that role.
See, you and I speak the same language. Yes.
Yes.
So I'm asking everybody this question, and it's been really interesting to see their responses. Knowing what you know now, what would you have done 2 weeks ago? What would you have done at the beginning of this pandemic?
For me, it goes back to fundamentals, foundational. I would have said, what's our plan, and let's put it in writing. Let's make a handbook. And I found myself saying that more and more. And Kindra's in a new role here. I'm in fresh eyes, and it's almost like we're coming in 6 months late because I think they've done a great job here. But I don't know that we have a handbook that says, when an employee test is positive, these are the next 5 steps, or this is the next 3 steps. We have a different entrance into our building. These are the things that, to get to that entrance, we're going to do. Whatever the case may be, if we had it in writing and so it was consistent, so that every week, every day wasn't a new meeting or let's all brainstorm, how do we do this? When in fact, we probably talked about it 6 weeks ago. We just have a different set of people in the room.
Right.
I see the documentation process that we've trained for and used with HICS has been too cumbersome for a long haul activity. So one of the things that I think happened along our route is we tired of what seemed to be a laborious process, paperwork process. So then we didn't put things in writing anymore. And when you put things in writing, you also end up with people who want to wordsmith it and who want to say, that's not what I said. And so we just didn't do it. And now we realize you have to put some things in writing, and you have to have some kind of a way to codify what you've done. But it has to be in an engaging way and in a way to remind people that, well, we've had that discussion before. Here's the conclusion we drew before. Now, how did we measure that this process doesn't work anymore? I mean, what people are tired, so they'll just say, well, I just know it doesn't work. I just know it doesn't work. Well, how is it you know that it doesn't work? And asking those good questions gets more and more difficult when you're tired and you're also fed up with it too. So it's difficult to ask to stay in that right frame of mind of asking the right questions. And then with providers, they're sick and tired of this too, and we've barely gotten started. And so they want action. They don't want any more discussion. You know, the doctors, the mid-levels, they want to know, fix it. Just fix it. Don't want to hear about it anymore. we've been at this long enough. You should just be taking care of this.
So Kendra, you and I spoke really early on, and at that time, you guys were just at the very beginning of an outbreak in long-term care. And all of a sudden, Burlington, Colorado was on the map for the whole state. How has that been since then? Has it calmed down, maintained?
So our relationship with our long-term care facility is very interesting. Our long-term care facility is a privately owned company, and they are not associated with the hospital. And the company that owns our nursing home, I don't even know if any of us in our community know who they are. It's a small investment group that owns it. The employees that work at the nursing home, probably half of them live in our community, and the other half live outside of our county. The residents are almost all from within our community. They have, from my observation, they've done a bang-up job following the rules at the nursing home. They've had ebbs and flows with their problems. How we know about it is through the newspaper. There's no direct line of communication between the long-term care and our hospital. And the problem was magnified because the medical director at the nursing home was a provider in our community, Dr. Hoppy, for years and years, and then he died in the middle of all of this. And so that particular, it demonstrates how fragile our system was. If he, it's just really, it put us all in a state of shock, them as well. And that conduit between the nursing home and the hospital was him for many years, many years. He was the common denominator communicator between the nursing home and the hospital. Upon his death, the nursing home chose to obtain medical directorship from a physician from Goodland, Kansas. And we don't know all the particulars of what happened with our own providers here, because honestly, our own providers were just okay with them going away, with the nursing home going somewhere else. But Darcy came along and said, well, we need to probably look at that because those are our people. I mean, the residents are our community members, and we want to do right by everybody here. So with her freshness, she made some of us calm back down and think about.
She made you calm down? I just want to get that on the record. Okay.
Yes, but the part that we just kind of set it on the burner. It's on simmer. We haven't really done much with it. There's an outbreak of COVID again in our community. Mm-hmm. And so it's been going on for the last couple of weeks. And so we're kind of waiting for this wave to calm down a little bit, and then maybe be a little more thoughtful about how we approach and what our providers. So the other thing that happened too, Monica, is Dr. Hoppy was seeing and admitting most of the patients in our hospital. Then on top of that, at our the clinic that our hospital owns and operates, there were 3 MDs and 3 mid-levels. And one of those MDs contract expired. So the clinic that the hospital runs, Park Health, has been short a physician since July Yeah, July 3rd, since July 3rd. So we're short that position and Dr. Hoppy's death. So we've been in this kind of whirlwind of problems that were foundational, and then mixed COVID in with it. So it has been, we're using local tenants, which we'd never done before. And so that's been a new process for this district. They're very expensive. Finding those that we can count on and depend on. I mean, we had a horrible situation where they let us know 30 minutes after they were supposed to be here that they weren't coming for the weekend. And so we've, you know, we hadn't really even had a contingency plan for some of those things. So how we're doing is, it's really hard to define because it really depends on how exhausted I am. When I'm really exhausted, I say fine, because I just don't want to talk about it anymore. When I'm not so exhausted, I'll say, well, maybe we should take it out and kind of contemplate how we really are doing, and what lessons we've learned and what we want to do more of. So, you know, I'm real strength-based. And so at this time, I just really find it even more difficult than ever to talk about our problems. But I think that there is a role for that. I think I've been remiss in not hitting some of those problems head on and just taking care of them so that we could then see the opportunities and the strengths easier.
Wow. It sounds like you have had this like amazing personal growth. I'm your friend, and for you to say that and for sharing that, good for you. That out of all of this craziness, and as scary as it is, to be able to step back and say, we could have done it differently. We could have done it better. And you will.
Mm-hmm.
And I think, Darcy, you were the one that talked about protocols. And when you were talking about the relationships, I think early on, when we had our first conversation, it was the strengths of the relationships in our community will get us through COVID. We spent half an hour talking about the strengths of the relationships. To go from the strengths of the relationships to now going to, gosh, the strength of the relationships plus protocols. And wow, that just sounds like that the community has had the opportunity for some enlightenment. So good for you guys.
So we also, our district, the hospital, I don't think I've talked to you since they walked out the 3 leaders of our hospital.
I heard, but
small world.
You heard
but
about
small
it.
world. And, you know, I'm old. If it's not my story to tell, I don't tell it. And you know that there's always multiple sides to it, but how did you guys step back and move forward?
So then on top of that, those 3 leaders were walked out, and within 3 weeks, we had 5 new board members. There's 7 board members, and we had 5 brand new ones. And the 2 that were experienced have been here 2 years.
Wow.
So then they were challenged with how to proceed. And there was a faction of people that wanted to go out and connect us right away to a system.
Mm-hmm.
And there were some of us who pushed and said, before we sign on any dotted lines, let's find someone to bring us to keep us afloat and think this through. And thanks be to God that our board found Darcy, because she really gets our culture. Mm-hmm. She gets our board. She understands the importance of governance and a new board. So one of the things I had told Darcy about you is that you worked for a board of county commissioners for 17 years. And so you get working for a board and a new board at that. And on top of, you know, of course, I mean, it's not a big secret when you walk 3 people out of the building, you know as well as anyone that there's undoubtedly some legal issues that go along with that. So those have to be dealt with on top of everything else.
So Darcy, you walked into a, we'll just call it a interesting learning situation. What did you do first?
You know, I think the first thing, just to recognize the people. I like people, and understand that the strength of any organization is the people, and that I've been in healthcare long enough to understand the burnout or the turnover, the personalities sometimes that come, and realize right away this was a very stereotypical building. You know, with, you know, the strength of the DON that works. She runs a meeting like it's an ER situation. That was pretty familiar to me. You know, the fact that the CFO probably is not the greatest communicator in the building, is probably more of an introvert. And so the personalities were pretty stereotypical. And then just the fact that this place needed stability, and they just needed someone to just listen to them. And you're doing a good job. And then I put in an interim, a new interim organizational. And we talked about it being interim. And we talked about, this is your opportunity to shine. And this is your opportunity to really be on the team and put some people in positions that they really wanted to be in. And with the understanding that it's interim. And if it works out, but that never once have we talked about, you know, there's going to be new leadership. And I think just being very straightforward, but very calm with them. And that's been that. So that was the first thing, is just to have really very transparent conversations. There's some things that I'm working on, of course I can't share, but nobody's tested that. But and then I think I live an hour and 15 minutes away. So these people could be my neighbors. I could be their neighbors. You know, I come from a very rural background, and that is, I think that is my superpower, is being calm. And you know, I actually met a previous board member that I went down, and he worked at a bank, and I don't know that, you know, whatever happened prior, but I spent some time with him, and he was so darling, and he said, "You just don't seem real flashy." And then he kind of backed up, and he said, "And I don't mean that poorly." And I said, "Absolutely not." I said, "That's a compliment." You know, the fact that, you know, I dress like everyone else dresses here. If I need to pull out a pair of heels and a little dress, I can. I normally don't. I wear a pair of slacks and a sweater every day to work. And so, because it just gives, man, she's trustworthy if she looks like us. And so until they truly get to know me, if I can look like I'm not flashy, and I look trustworthy. And so the main thing was stability in these buildings. And whether you're in a pandemic or not, healthcare is upside down. And we've got to be stable, and we have to be calm. And even if we make hard choices, and even if people maybe don't get to stay on this bus, we're going to do it calmly. And we're not going to do it with police. We're going to do it after a conversation. And that's, I guess, the first thing that I recognized, is we got to be stable.
Do you have everything you need? PPE, and it sounds like you have the human capacity, the board staff.
So we are actually looking for some nursing help right now. We've not been using a traveler for a while, a very short while, but we found ourselves in a situation with our permanent staff who, well, to be truthful, Monica, there's several of them that are pregnant at the same time and due here about the same time. So we have some maternity leaves to deal with, and we want to be sure that we do that. And Darcy's been so supportive of that, because if we mess that up, we'll never get a second chance on that one again. And so the human thing to do there is to get some help, and particularly our vulnerable staff whether it's due to pregnancy or whatever, she's working really hard to make sure that our vulnerable staff, that those at higher risk, are not put in a risky situation with a COVID patient. So we are working on that.
Other than your initial hiccup or exodus, have you had a lot of turnover on staff?
You know, we've not. In fact, what we've done is by attrition, as people are moving on, just we're not replacing. We're trying not to replace those positions, and so we're probably not hiring. But we're you know, I think since I've been here, there was one termination, and it was, you know, it was for other reasons and needed to happen. But we're not seeing a mass exodus. The people that are leaving for different reasons, and you know, maybe had been looking for something a little more stable prior, but we're not seeing a big turnover in any of the technical or our patient care areas at all.
Other than, well, I'll keep my eyes out for nursing. I happen to know some nurses that are maybe looking for some challenges, so I'll talk to some DMP nurses to see if they can help with that, the rural story. I heard an amazing quote from a healthcare provider that she told me that COVID will be remembered as the world's timeout.
Mm-hmm.
And as a mom, that really speaks to me. How is your community going to reflect back on everything that happened with the change in admin and the quantity? How's the community going to remember this?
You know, I think they're going to tie COVID to the change in leadership. I mean, I think, and to the passing of the physician. I mean, because it all happened so simultaneously. And so I think the board's next decisions that they make on leadership, whether it's an affiliation with a bigger system or a regional affiliation or whatever it is, the success or failure of the permanent leadership is how people will reflect on COVID and whatever's happened here. And so I would never say that to somebody that was interviewing because that would scare anyone away. But I think that for me personally, and you know,
and I agree.
You know, I just think that this community is giving this organization a lot of grace. I have not had people too much in my office upset. And I think everybody's just saying, we have a new board, we have interim leadership, and we're going to give people a 6-month grace period before we start showing up at these board meetings or, you know, letter to the editors or whatever happens in a small community to say, okay, here's your timeout, and here's your, you know, we'll see how this happens. And so that question can be answered, I think, in 6 months with the success of leadership.
Maybe in 6 months we should answer that question. How are you going to decide when normal happens again, when you're bringing people back? Is there a benchmark, a protocol established in the community? Or are you just kind of waiting? Is 2 cases too many in your community? Are they playing football, Kindra?
Yes, our
Okay.
high school is playing football again.
Okay, good.
And the 5 school districts in this county are all playing football again. Our little peewee kids are playing, so that's helpful.
Yeah.
As far as though, you know, we had a period of time at one of our elementary schools where they had to close down for two weeks, right at the beginning of the school year. We have another school district in the county that had to send home their elementary kids for 2 weeks. So we certainly have controversy in our schools around COVID. We have a group of people in our community, well, you know, we're just like you guys, that are insisting that this is all just going to go away and it's a conspiracy theory, and that, you know, COVID really isn't that big of a deal. And then we have others who are are really tired of standing outside the window of the nursing home to see their family members. We just were having a discussion before we came in here about our own district's policy. When we admit a COVID patient, you know, we say no visitors, but the truth of the matter is there's no one on our staff that could exclude a significant other. So when they come in and they're sick, we are not shoving out their one other person. I mean, we can get tough about many people, but they're one other person. There's just none of us that are going to shove them out. And then Darcy was articulating how, yeah, we know if we have to ship that person out, their loved one might not get to go with them. And in the big hospital, they're not going to get to go in. But Darcy said, we will identify the support person for that significant other that remains here in the community. And we'll by golly make sure that they're getting regular Zoom meeting or, you know, video conferencing with their loved one and the team that's caring for them. And we'll facilitate that communication because culturally that's the right thing to do.
So Darcy, not to put you on the spot, but does your hospital have a policy of never dying alone?
You know, I couldn't answer that.
I'll put Kindra. Okay, I'll put Kindra on the spot. Kindra, does that?
So we don't have a policy on that, but no one does. We don't. I worked in hospice for the last since December, I guess, or even November last year until very recently. And the hospice patients that we brought into the hospital 24/7, there was someone with them. And even in COVID, we let in family members. And so they not only had a nurse, they had a family member with them.
And hence the beauty of the small rural hospital. I've spoken to several nurses, and it's the nurses who have brought up the comment of saying they work in a facility that does not have a policy about dying alone, but they as nurses have developed their own policy. And to me, that's beautiful. Had family members who had COVID. My brother and sister-in-law celebrated their 50th wedding anniversary, and he was in the hospital with COVID. My mom's having knee surgery today by herself in the hospital in one of the big facilities here. So good for you guys. You know, I think that's the beauty of the rural. I'm a K-State grad, a Kansas girl myself. So yeah. So keep it up, guys. I mean, that's letting your community understand that and know that that's the benefit of the rural experience. That you can say that they aren't going to be alone, because it is kind of commonplace for us rural people. But interestingly enough, hasn't been what's happened in a lot of places, that nursing staff wasn't afforded the opportunity to allow people to have family members there. So good for you guys.
Yeah.